What is up, guys? Thanks so much for joining me today. I wanted to give some quick tips here on how to handle studying if you are a visual learner. And a lot of times it's hard to figure that out, right? Um, one thing that I try to do when I do group coaching stuff or one-on-one coaching stuff with people that are having problems with EMS exams is to kind of figure out which way they learn, okay? Because knowing the way you learn and understanding it is going to help you spend your time much, much better when it comes to trying to figure out how to study and how to learn, right? Guys, I put a link here in the notes for the free download of the EMS differential diagnosis resource that I put out there. So if you want interested in that, go to emsseo.com/DX. You can download that digital resource for free. And I think it'll help you when it comes to making a clinical impression of your patient and kind of understanding things that go on when your patient is calling for a specific problem, but it might be something different. So go check that out if you're interested in that. But when it comes to the visual learning aspect of stuff, guys, for me, I'm basically a visual learner, right? I do good when I hear things or being auditory, but I'm much better when it comes to visual reading, writing, stuff like that. Okay, like if someone's telling me a story about something, right, and they want me to kind of figure out what the question is, okay? Jim, I had this question on the test. It was blah blah blah. I kind of need to see the question to understand better what it is that they're looking for. Okay, so I'll ask them to give me the paper, ask them to write it down and show it to me, stuff like that. Okay, so that's something that I do because I'm more visual when it comes to learning. I do the auditory stuff as well, but hands-on, I learn, but that's more for skills, not necessarily when it comes to actual content. Okay. Now, some of the things that you do when you're a visual learner, of course, is taking notes, right? But when you take notes, you can't be taking notes that's verbatim what the instructor is telling you, okay? First of all, you're not going to remember everything that they say, okay? And trying to write everything verbatim is going to be very difficult, and you're going to end up getting lost. You want to write down key phrases, key terms, okay? Key medical content areas, key things that kind of fit together, okay? You want to get and put that stuff down and think about what the instructor is emphasizing when they're going through the content, okay, to kind of trigger you to go read and write and take notes on those specific content areas, okay? And think of what they're writing on the board as well, if they're writing anything on the whiteboard or a blackboard, so you can go ahead and kind of take notes based on that as well. Again, try not to be verbatim what they're doing. Put it in your own words, okay? Because you want to go ahead and when I say to put in your own words, I mean like after class is done, a good way to go ahead and kind of reinforce what you did is to reread your notes, rewrite your notes, okay? Because the process as being a visual learner, process of rewriting it and rereading it is going, and you're actually seeing your words, seeing the content, is going to really help you commit that content to memory much better. Okay, and of course, I always recommend handwriting. But if you type it, if it works for you, go ahead and do that. But a lot of times, handwriting is going to have a much bigger impact when it comes to handwriting the actual content. Now, the other thing I say to you too, guys, is do outlines. Okay, because that is going to help you when you outline the content. All right, you're going to organize it that way much better. Again, you're going to organize it in a way, more importantly, that's clear to you. Right? It's going to be clear to you how the different things fit together. Okay, P, Q, R, S, right? You're going to outline that, but outline it in a way that's fitting to you and how you're understanding it, okay? And this is going to be much better for you because of the visual learner. When you see this, okay, you're going to learn it much better because of the sight and because the fact that you're thinking through the material based on the outline that you're making. Okay, so write it in an outline form. It's going to help you really kind of create patterns and kind of create ways that you're going to be able to kind of piece everything together, okay? And that's going to be much better for you because you're going to be easier to recall it during exams, and you're going to recall it in a much clearer fashion because you made the outline how it fits for you, okay? Just some things to think about, guys. If you haven't tried this and you're a visual learner, give it a try. You might find that content that you're struggling with is going to really go ahead and help you out and really be able to help you kind of narrow down and grasp material that you might be struggling with, okay? So keep that stuff in mind. The last thing, guys, I want to mention to you, and this is something that a lot of people struggle with, they push back on me with this, okay, is giving yourself quiet time, okay? Believe it or not, people that are visual learners, myself included, I do much better when I study in a very quiet environment. Libraries, a quiet room, stuff like that, places that I'm comfortable, okay? I get visual learners who tell me, oh, I have to have music blasting in the background. I have to have music in my earbuds so I can go ahead and understand the content better, and I have to have that going on in the background. But studies have shown that if you're a visual learner, okay, like I've described, that you're better off being in a library, in a quiet room, uncomfortable, no distractions, okay, including distractions from this thing, right? That is going to be much better for you as a visual learner, okay? Study groups might not be a good thing for you either, okay? That's another thing because there's a lot of distractions there, okay? And maybe sometimes, again, I'm going to kind of go over auditory learning as well and hands-on learning, how you can kind of piece that together when it comes to understanding content in other videos. But you might be able to use kind of two of them. Maybe you're kind of auditory and visual like me. Again, I'm more visual, but I will use auditory as well, right? I will use hands-on. So for you, you might be able to piece in, two or three of them in order to go ahead and best understand how you learn more efficiently, okay? So as we go, I'm going to go on, put those in other videos as well, and maybe you can kind of add a section of each one that will help you, okay? But when it comes to visual learning, again, try to get into a quiet place. Do the things that I mentioned as far as taking notes, writing outlines, okay? But also, when it comes time to studying, guys, use a quiet environment. Studies have shown that for visual learners, if you're strictly a visual learner, that a quiet environment is much better than having music in your ears, being in a study group, okay? You really need to be able to see it. You want to and kind of think through the content, okay, before you're able to understand it. And by being in that quiet area and that comfortable area is going to give you enough time to actually go ahead and process that material, process that content. All right. So guys, again, these are just a few tips. I hope maybe you try one of them, try the notes. And like I said, notes in your own words, rewriting them, rereading them, making the outlines. Maybe one or two of those methods might help you, okay, understand the content that you're learning to be a good paramedic, to be a good EMT, and to pass your exams. All right, guys. Again, I did mention before the differential diagnosis guide that I have. It's at emsseo.com/DX. It's a free download. You can go get that at that domain. There's a link here in the notes as well, and you can understand what I mean when I say your patient didn't read the textbook, right? Not every patient that calls for chest pain is having a heart attack. There's other things that might be going on, and this guide that I compiled and put together is designed to help you think about other things when it comes to those types of calls that are very common, but when you get on scene, it could be something way different. So go check that out, guys, if you're interested. Let me know your ideas as well. If you're a visual learner and this is the way you learn best, put some comments in the notes below. Let me know how you go ahead and study and prepare for exams as well, and it might help somebody else out there too. All right, guys, that's it for me. As always, I am Jim Hoffman from emsseo.com. Stay safe.